Hello, everyone. My name is Bonnie Baker. I'm the Executive Director of the Canadian Lymphedema Framework. On behalf of everyone at the CLF, I'm excited to welcome you to episode 4 of Pathways Live, Authors in Conversation. This special live stream series brings some of our magazine's most compelling articles off the page and into real-time conversation, sort of like a book club for lymphedema care. Each episode features the author of a selected Pathways article. This is a really special episode today, so perfectly suited to lymphedema awareness and advocacy for the month of March, and just ahead of World Lymphedema Day tomorrow. Before I introduce you to our host and our guest author for today's episode, just a couple of notes. Prior to joining us today, we shared a link with you for the digital access to the reading materials for this episode, including the article that our guest author contributed to our magazine Pathways. In case you did not receive the link, or if you need it again, we'll place a link to that in the chat here of the live stream for you. We hope you have a good internet connection and a nice quiet place to enjoy the live stream, but if you should happen to get disconnected for any reason, please know that we are recording the session, and we'll share a link to the recording with you later this week. We'd like to take a moment now to acknowledge the generous support of our industry partners whose sponsorship helps the CLF to deliver great programs like Pathways Live to you, our lymphedema community. Our sincere thanks to our diamond partner Bauerfeind and our platinum partner Juzo, and to Essity, Medi, Waries, Lymphology Skincare, Sigvaris, and LNR. And now, without further ado, I'm pleased to introduce you to our host for today's conversation, our Pathways Editor-in-Chief, Anna Kennedy. Anna is a CLF founding member and the editor of Pathways, the CLF's official publication. She spent 30 years in corporate senior management, working in the areas of training and communications for international companies like Thomas Cook and American Express. Her last business role was as vice president with Indigo Chapters before she transitioned into the nonprofit sector in 2006. Anna served on the board of the International Lymphedema Framework from 2012 to 2020 and was the CLF's executive director from 2014 to 2019. She was awarded the Queen Elizabeth II Golden Jubilee Medal in 2002 for her leadership and contribution to the lives of Canadians. And she lives in Toronto, Canada, where she advocates for healthy living and a positive attitude for living with lymphedema. Please join me in welcoming Anna now.
Hi, Bonnie.
Hello, Anna.
Hello.
How are you doing?
Pretty good.
Good. I should warn our audience that Anna is joining us bravely with a respiratory illness today. So we'll hope that her voice keeps for us.
Absolutely.
I'll let you go on. I'm going to slip backstage and let you go introduce your speaker for today.
Great. I'm really excited to be the host of this Authors in Conversation series. My role as editor-in-chief of the Pathways magazine means that my work is primarily remotely and online. I coordinate the author submissions, I edit, I write online, and prepare everything for the production of the publication. But rarely do I actually get to speak live with others involved in the magazine, especially the authors. And this is a unique opportunity to connect with Heather, but also to connect authors with our readers as well. Today's topic and article for discussion focuses on advocacy and what groups and individuals can do to work toward making lymphedema care accessible to all. I'm honored to introduce Heather Ferguson. Heather's son Dylan was born with primary lymphedema. He was prescribed his first set of compression garments when he was only 7 months old. When their insurance plan refused to cover these items, she dedicated herself to closing this coverage gap. In 2009, Heather worked with her state representative to pass the North Carolina Lymphedema Diagnosis and Treatment Act in an unprecedented 4 months' time. She then turned her efforts to improving coverage nationwide, and later that same year was successful in securing her congressman as the sponsor for the first ever federal Lymphedema Treatment Act in the U.S. In 2010, she founded the Lymphedema Advocacy Group to raise awareness and support that would be necessary to move a bill through Congress. And then in 2022, the Lymphedema Treatment Act became law. The Lymphedema Advocacy Group continues to work on insurance issues and improving access to care in the United States. In her original article for Pathways, Heather offered 10 tips to keep in mind when planning a meeting with policymakers. Heather recently joined us in Niagara Falls last October at the 12th International Lymphedema Framework Conference and gave an inspiring keynote address. But that was not the first time she was introduced to the Canadian audience. She's written several times over the years and presented at Canadian Lymphedema Framework conferences in prior years. We're very pleased for the opportunity to learn from her and her experience. Heather, you and I first met 15 years ago when we were both participants in an initiative called the Lymph Science Advocacy Program, more commonly known as LSAP. This was a training program for patient advocates for research and education about lymphedema. It was sponsored by the National Lymphedema Framework, the NLN, and the brainchild of our friend Saskia Theadens, who was the founder and previous executive director of the NLN. The goal of this program was to engage and motivate patient advocates and caregivers to action. It was at an NLN conference when I first heard and was touched by your personal story of struggling to get compression for your baby Dylan in the United States. It's a little sobering now to see how much time has passed that you and your baby Dylan have now grown as a full adult. Please join me in giving Heather a very warm Canadian welcome.
Thank you so much for having me, Anna.
It's so much fun to connect with you on this call. I know the conference last fall was a little busy for both of us, and we were running around like mad women, but and barely had a chance to catch up. But catch up we always do at these events. In order for our audience to get to know you a little better, perhaps you can spend 2 minutes sharing what a typical workday looks like for you as a mother, wife, and lymphedema advocate.
Well, I would say really the message is there's not a typical day. The Lymphedema Advocacy Group is an all-volunteer group. So while I do try to do my advocacy work during the hours that others are available that I need to collaborate with, I'm really squeezing it in whenever I have time. So in addition to business hours during the week, it's nights, it's weekends, it's working around my other job, which is teaching ballet because I'm a former professional ballet dancer, and of course around being a mother and other family responsibilities. So there's not really a typical day.
And I wasn't surprised to hear years ago that you were a ballet dancer. Just you're tall, you're slim, you're beautiful, and just the way you carry yourself, I'm sure does you well in your presentations and just the way you come across. Sorry, I think I had a paper in front of the camera there. So what are 3 things you like to do when you do find some time to relax?
Obviously spending my time with my family. I also love to do crafts. I love to go thrift store shopping. And I'm a cat mom, big cat person, so spending time with my pets as well. I would say those are the highlights.
Yay, I didn't know that about you and thrifting. I love thrifting. I just spent a couple days in New York with my daughter from England, and people are amazed that we spent a bit of the time not just doing sightseeing, but checking out some awesome thrift shops in Brooklyn and Manhattan. So it was a lot of fun. So your journey started with your son Dylan as a baby. Do you want to tell us how that journey started and when you knew you needed to do something to change the status of getting compression garments for him?
Yeah, so he was born with a bit of swelling that the doctors dismissed as nothing to worry about, but it steadily progressed and worsened. And by the time he was 2 months old, he had pitting edema in both legs and feet. And at that point, that's when his pediatrician became very concerned about something being wrong. And their initial concern was that he was experiencing heart failure. So he was hospitalized for a few days. And of course, that was very distressing. But they did thankfully quickly rule out any heart issues, as well as any other major organ issues as far as they knew. Like they ran every test they could think of and they were all coming back normal, which was a relief, but we weren't getting any answers for why he had this swelling. So that it felt at the time very drawn out process to finally getting a proper diagnosis when he was about 3 months old. But now, of course, I've met many other patients whose diagnosis is delayed not only for months, but sometimes years or even decades. So in hindsight, my son was lucky to be diagnosed by the time he was 3 months old. So he began treatment with a lymphedema therapist at that time. And at 7 months old, he was prescribed his first set of compression garments, and that's when I learned about the coverage problems. So my initial reaction was, oh, it's just a mistake, or it's possibly a problem just with our particular insurance plan or insurance company. And of course, I learned that that was not the case at all, that this was a widespread problem. So I spent 9 months appealing that first denial for my son's compression garments. And in the end, the insurance company agreed to cover his garments for 1 year, which is a completely unacceptable response for a lifelong chronic condition. And I had the realization at that moment that if this didn't change, I and later Dylan were going to be fighting for access to the treatment supplies he needed for the rest of his life, and that the coverage gap just had to be closed, and that in the absence of anyone else doing it, I needed to do it. And that's when I decided to make it my mission.
Wow, that's an inspiring story. And how's Dylan doing now? He's definitely not
He,
a baby anymore.
he's doing great. He's 19. He's in college. So he has taken over all responsibilities for his own self-care. He's always been very compliant about wearing his compression garments. I did his manual lymph drainage every day through up until his teen years, and then he started gradually taking it over more and more, and now it's obviously completely his responsibility. He's, despite his excellent adherence to treatment protocols, he does occasionally get infections still. So he's gotten very good at recognizing the early signs, and his doctor, for a long time, he's kept antibiotics on hand at home so that we could begin them as soon as he was sure that he had a cellulitis infection. So he's able to recognize that and make those decisions for himself now. So I'm very proud of him, how responsible he's been, caring for this condition, because it's a lot, as you know, as anyone who deals with this knows.
Yeah. Interesting about his carrying antibiotics. I have done that for the last 20 years, and the number of times that I've been abroad and suddenly recognized the signs. In the very early years, I would take a picture and send it to any of the doctors on my board and say, "Do you think this is cellulitis?" And they'd say, "Yes, start taking it right away before you get on that plane." And so I've averted full-blown cellulitis on several occasions, but also did end up having it as well. But traveling with antibiotics, if you're a traveler, is a great idea and something you should talk to your therapist about.
Mm-hmm.
So can you start by giving us a short synopsis of what the Lymphedema Treatment Act is and what it means to anyone living in the United States? So what specifically does it cover and what does it not?
Yes. So the Lymphedema Treatment Act was a federal bill that created a benefit category so that Medicare could begin covering these supplies. So for those not familiar with the healthcare system here in the United States, Medicare is the insurance plan that all Americans age 65 and up are on. And some Americans who are under the age of 65 can go on to Medicare if they are disabled. But it's primarily 65 and up. And it is overseen by Congress, in that Congress set it up, and there are these defined benefit categories for everything. And the items were not previously covered because lymphedema compression supplies didn't fit into any of the existing benefit categories. So the typical daytime compression garments last about 6 months. But the category that it seemed like they should be covered under is durable medical equipment, and our Medicare, defines durable medical equipment as needing to last 3 to 5 years. So maybe there are some nighttime garments who might last that long, depending on their use, but definitely not your daytime garments are not going to meet that longevity requirement. So that's why legislation was needed here in the United States to create a benefit category that these items could be covered under. So that's what the Lymphedema Treatment Act did. And so it directly affects anyone who is on Medicare. Now, all other health plans in the United States, of which there are many, many other plans, are not directly affected by the Lymphedema Treatment Act. They are not required to offer the same coverage. But here, most plans follow the standard set by Medicare. That's why this was the big top-down fix. And now we still have a lot of work to do, making sure that all of the other plans eventually do cover compression supplies and that they cover them at the quantities patients need. Because typically right now, a lot of these other plans cover them, but maybe only 2 or 4 garments a year. And if you're affected in multiple limbs, that's maybe 1 set of garments right there is your whole allowable quantity. So we still have work to do, but that's what the Lymphedema Treatment Act did, is create that Medicare coverage. And it also set a great standard for what should be covered in the quantity limits. So under Medicare rules, patients get 3 sets of daytime garments every 6 months and 2 sets of nighttime garments every 2 years. And there's no limit on bandaging supplies or accessories. And that term sets is so important because it makes sure that patients who are affected in more areas of their body still get the quantities they need. So a set is considered a compression garment for each affected body part. So a set for one person might be 1 single garment. A set for another person might be 4 garments or even more. So it was very important that the new coverage be equitable for all patients. And that's a very important standard that's been set now.
That's great. I'll talk a little bit later in the conversation today about some of the changes or the differences between the US and Canada. But when you talk about a set, many times in Canada, we refer to that 1 to wash, 1 to wear. So while one, you've been wearing it all day, and at the end of the night, you take it off and you wash it. It might not be dry the next day, and the next day you've got a clean one to put on. So that varies from province to province, but for many or some, a set does include 2 for those reasons. So in 2019, you wrote a great article in Pathways, which was the steps to effective advocacy. You outlined your 10 steps to close the coverage gap and how to meet with policymakers. Do you want to choose 3 tips that you want to expand on because they're so crucial to advocacy?
Yes, so I did reread it myself and pick out the 3 that I think are the most important for advocates to follow. And the first is tip number 3 in the article, which is come prepared, be concise, and save time for questions. So I think we all have the tendency, myself included, to ramble sometimes if we're not well prepared. And when you are lucky enough to get a meeting with a lawmaker or their staff or someone else in a position of authority who can help you, likely that time is very limited. So you need to make sure that you're making the most of that time. So really being prepared with what exactly you need to talk about and sticking to those points, being concise, and the questions, the saving time for questions part is extremely important because you don't know what they don't know. So if you don't give them an opportunity to ask questions, then they might not be learning from you the most valuable piece of information that they could walk away from that meeting having learned. The second tip that I think is very important is make sure that your ask is well thought out and realistic. So don't just come, unload all your problems, say this is what's so terrible and why it's not working without having a viable solution to suggest. If they've given you a meeting, chances are they want to be able to help you. So you need to help them help you by coming in with a realistic ask about what they can do to make the situation better, whatever it is you're asking for help with. And the last important tip is if you get a no, ask why, because you're going to get a lot more no's than yeses, and you need to learn from them. Sometimes those meetings, even though they're disappointing and frustrating, those are the most important ones of all, because if you're not uncovering what the obstacles are to getting whatever you're trying to do done, then it's hard to move forward. So asking why they're not willing to do something or why they're not willing to support something is extremely important information for you to get.
That's great. Thank you. Thank you so much. I know you and I have had conversations before about the differences between the Canadian and the US healthcare systems. But for our readers or our listeners, sorry, Canada's healthcare is different in how so it's very difficult to compare apples to apples. Our system, known as Medicare, is publicly funded and universal coverage for medically necessary hospital and physician services. The federal government sets the national standards via the Canada Health Act, but it's up to every province and territory to manage and deliver additional services. And compression and falls under that. So the reimbursement for compression garments, as an example, varies greatly from province to province. Because of this decentralization, it's important that every local, provincial level has to do their own advocacy efforts with their own ministers of health, their own deputies, etc., and the policymakers. So on one extreme, some provinces provide no reimbursement at all, nothing, zero, whereas a few others might offer up to 75% of the cost of garments 2 or 3 times a year. Others, yet again, only cover compression if it's related to breast cancer, and all other lymphedema patients are out of luck. So some provincial lymphedema associations have had success in improving the percentage of the reimbursement, or trying to get some kind, or the number of garments per year, the number of sets. Other provinces are in the midst of a multi-year advocacy effort. And kudos to anyone on the call. Some of the provincial association directors and board members might be listening to this, and we applaud the efforts that you continually make. So the Canadian Lymphedema Framework acts as an umbrella, supports those provincial efforts with materials, regular reports and charts outlining what those discrepancies are. And we did one a few years ago that shows from province to province what that might be. So do you have any suggestions, given our unique political support of healthcare, that might help present these efforts differently? What might apply?
Sure. I think from the outside, looking at what we've accomplished here in the United States, it might seem like, oh, it's easier. They have this one big national plan, but we have, yes, one big national plan for age 65 and up, but literally thousands of other plans that cover the rest of the people in our country. So maybe this is a bit of the grass is always greener on the other side sort of thing. But I look at Canada and think, oh, I wish we only had 5 different plans, that we had to work with and accomplish these goals. So I guess that's my first point, is I would not be daunted by the fact that you have to deal with this at the provincial level, because I think this is very doable. And so some of the parallels, though, between what we did here that I think apply to your efforts there is when we were talking to federal lawmakers about the need for Medicare to cover this, we leveraged the fact that these supplies were already covered by a lot of other health plans. And so I think that you can, the provinces that have worse coverage should be pointing to those that have some coverage and better coverage and saying, aren't all Canadians equally entitled to treatment for their disease? Why should where I live determine my access to care? So I think that's one talking point that you should leverage. And then again, coming back to my third of my top 3 tips from the article, if you're getting a no, ask why. Like, I feel like I know I don't fully understand why in a country that, from my perspective, has great healthcare, far better than our system in so many ways, how these supplies can't already be covered. So in our case, there was a true obstacle. They didn't have a benefit category. It wasn't that they didn't think that they were important or didn't think that they were medically necessary. There was a true obstacle for them to cover these supplies. So I feel like it's important to understand what is the obstacle, and it might be different in each province, but making sure that you're actually speaking to the reason why the coverage isn't already there. Like, is it financial, for example? Because the financial piece was ultimately our biggest obstacle. everybody agreed they should be covered. But in our country, when you pass legislation that has a cost associated with it, Congress is mandated to also say how it's going to be paid for. So if it is a cost issue in some of the provinces as well, I think you need to leverage the fact that, okay, yes, there is an upfront cost to covering these medical supplies, but you're going to save more in return for reduced hospitalizations and other complications, which you are paying for now. And so we have a lot of cost savings data that we used here. Some of it was from international sources as well, not even just limited to the United States. So I think leveraging those things, if cost is the reason anywhere. But, you know, if you know, like, if you can tell me what's a reason that has been given why it's not currently covered or why they can't cover it at this time, do you know?
It's almost always cost. And
Okay.
so some of the provinces that, as you say, we've got opportunities when there are, well, not 5, but 13 provinces and territories that have
Sorry.
to, that's okay, that's the number of times. And so the benefit is if 1 or 2 provinces have already made some inroads and, you know, can show, look, you know, why, as you say, why should patients in Ontario and Quebec be treated differently than someone out east or someone in Saskatchewan or you know, Manitoba. And any of the provinces that might have already done some great presentations on cost analysis, and some of those suggestions we have gotten from the US. I know Bob White was instrumental years ago in giving some points in how to break down the, you know, the cost of hospitalization and cellulitis, et cetera, versus time away from work, lots of things like that, versus the cost of compression. I think the fear of many of them, of the policymakers, is as lymphedema awareness grows, the cost will just keep growing of compression. And so it's good that it's good that lymphedema is gaining traction and awareness and education, et cetera, but the policymakers wish that it was still kept under wraps so that the costs don't keep going up for this reimbursement.
Well, I understand that. And of course, the situation is the same here. But just because those patients weren't aware of it and possibly seeking to get garments for themselves doesn't change the fact that they still had it, and the fact that it wasn't being treated at all because perhaps they weren't even properly diagnosed means that they were at even higher risk for infection and other complications. So it still comes back to the fact that whether or not they know they have lymphedema or not, they're still out there, you know, incurring costs that are related to this chronic disease not being properly managed.
Yeah, absolutely. And I think another great leverage in Canada is because some have made some inroads, you know, showing, as you said, a chart to those policymakers saying, here's the discrepancies across Canada. Try to explain that to me. Why? Because I happen to live in this province, am I disadvantaged versus do I have to move to another province to get full coverage?
Right.
And the more that provinces can share their advocacy efforts with each other and show the reimbursement coverage gaps that the Canadian Lymphedema Framework updates from time to time, I think that's a great suggestion. There's so many gaps in lymphedema diagnosis, research, care, and often patient advocates get frustrated and impatient wanting to address it all when they're advocating. However, you chose in your group to singularly focus on coverage for compression, rather than some of the other elements like treatment, manual lymphatic drainage, et cetera, more certified therapists. Can you discuss that strategy and how that worked for you?
Well, I think there's 2 parts to my answer. There's my personal decision, and then there's the decision as an organization. So for me personally, I chose this because I felt like it was the most glaring need. Like, certainly my ultimate desire is that there's a cure and then my son doesn't even have lymphedema anymore and he doesn't even need the compression garments that I worked for so long to get covered, right? But say that happens 20 years from now. Well, imagine the horrible state he would be in if all of those years he didn't have access to compression. It's no different than any other disease like cancer. We all want a cure for cancer, but in the meantime, people need to have access to the best possible care available to them today. And lymphedema shouldn't be any different. So I just saw this as the most pressing, urgent need. And as soon as I dived in, I really saw like it was going to be such a big effort that it needed to be my singular focus, which is not to say that that's the right choice for everyone. But I do think that if you don't at least narrow it to maybe 2 or 3 things that are the most important to you, you run a greater risk of burnout because you're not seeing the direct benefit of your involvement. So that's on a personal level. And then as an organization, I mean, the Lymphedema Advocacy Group was literally founded for the purpose of advancing and passing the bill. It didn't exist at the time that the bill was introduced, but because I'd had that little bit of experience under my belt passing a state bill, and I could see how much we were going to need to scale up the effort to focus on a national bill, I quickly realized that we needed an organization dedicated to that cause. It was not my original desire or intent. I had worked with the National Lymphedema Network a little bit, and I thought my role was just getting the member of Congress to introduce it, and then I was going to kind of hand it off to another group. I did not expect this to turn into a lifelong, well, maybe not the rest of my life, but so far it's been the rest of my life since that time. This is not what I had intended or how I envisioned it would go, but I saw that there was the need for that. So, that was the singular focus of the Lymphedema Advocacy Group all the way, not just through passage of the bill, but implementation of the coverage, because the year in between the bill passing and the coverage starting was just as important as getting the bill passed itself, because the bill only created the capability for our Medicare plan to cover these items. It didn't say how many or how often or any of the other details. So if we had worked this hard for patients to get one set of garments per year, we really wouldn't have fulfilled our mission. So all of those details in the rulemaking process were just as important as getting the bill passed. So it was really only once the coverage started that we could say, okay, do we need to continue to make this our singular focus? And is that what we want? Or are we ready to branch out into other things? And so we have started to branch out. So the Lymphedema Advocacy Group remains focused on improving coverage policies. And that's not just through legislation. In most cases, legislation is not necessary. Usually those are policy decisions that can be made either by the insurance plan or the people who manage the plans. But the Lymphedema Advocacy Group is still focused on making those kinds of improvements. But we realized that awareness and education, we really needed to step up our efforts there to make sure that everyone who was eligible for this new insurance coverage knew about it and understood their rights and how to access the what they were now entitled to. So for that reason, we actually started a second organization called the Lymphedema Education and Awareness Project. So now the new group focuses on the awareness and education piece, while LAG, the original group, continues to focus on more policy improvements to expand coverage. And for those of you in other countries, I don't know what your situations are, but here in the United States, we have different types of nonprofit organizations. So the Lymphedema Advocacy Group is a 501c4 nonprofit because obviously all of our work has centered around lobbying related activities to try and improve coverage. Whereas the Lymphedema Education and Awareness Project is a 501c3 nonprofit, which is the type of nonprofit most people think of when they think nonprofit. And that organization is eligible to apply for grants, whereas the Lymphedema Advocacy Group is not. So It opened up some possible new funding streams for us to have a 501c3 organization, but we definitely did not want to give up our 501c4, the Lymphedema Advocacy Group, because there's still a lot more work to be done on those two fronts. So that's the reason for two groups going forward to kind of focus their efforts in those different areas.
Great, thank you for that explanation. Certainly, education, research, comprehensive care is very important, but certainly compression is probably the one singular portion of the four elements of treatment and care that is the most evidence-based. You and I were both fortunate enough to be part of the LANA Summit a couple years ago, where I think it was 70 people got together, health professionals, researchers, and a few patient advocates were involved, as you and I were. And, we saw that compression it's the easiest to justify if you're meeting with policymakers in terms of the evidence, because they're always going to ask, what's the evidence? And so, yes, we know manual lymphatic drainage and exercise and skin care are very, very important. But if people always ask me as a patient, I'm not a medical professional, if there was one singular thing that has kept your lymphedema at bay, or been able to manage it for the last 20 years, I'd say compression, compression, compression. I get up in the morning, brush my teeth, put my compression garment on. At the end of the day, I brush my teeth and take the garment off. And that's, full stop. And so I think you're right to choose that as a strategy, the compression. And I would think most of the advocacy efforts in Canada have been that, because that's the biggest gap and that's the biggest cost as well for patients, especially if you need multiple garments, have multiple limbs, etc. And those garments are expensive. Compression garments, if they're custom, I have custom ones, they can be hundreds of dollars. So even in Ontario, as an example, where we have 75% of the garment covered, I still pay the 25%. That 25% can still be $100 several times a year. And so for many people, they have to forego compression simply because they can't afford it, whether it's they're paying the 100% or part of it.
Right.
So
I think you can use that to, again, when you're in your conversations in Canada, the same talking point we used, that they are paying for patients to go to a lymphedema therapist, right? You have coverage for that. You do not necessarily. Okay, well, scratch that. I was going to say, to your point, even though this is a very multifaceted, approach to managing lymphedema, the piece that makes it all work is the compression garments. You don't get lasting benefit from your manual lymph drainage or your use of a pneumatic pump, right? If you don't have that garment to put on in between those sessions. So never mind. I was going to say that you could make the additional point that they're paying for these other things that don't really work without the compression garment to maintain the gains that the patient makes with the lymphedema therapist or by using a pump. Do you have coverage for pumps?
Again, it depends province by province, sometimes only for primary lymphedema.
Interesting.
Not secondary. And the physiotherapy or manual lymphatic drainage, again, most provinces does not cover. They don't, for many years ago, some of the provinces covered physiotherapy as a health benefit. But, and so obviously for those patients going to manual lymphatic drainage therapists that were physios, not massage therapists or occupational therapists, that was covered. But it's probably been 10, 15 years ago, for example, in Ontario, where physiotherapy is not covered either. And so it was, I remember 15 years ago discussing with people whether it was worth the advocacy efforts to try to get manual lymphatic drainage covered. But if physiotherapy for a broken arm isn't even covered, why would I So I certainly, that's just my personal opinion, I definitely believe it's compression, compression, compression that we should be advocating for as a start, and then hopefully going on from there.
Right. And I would be careful about calling them expensive, at least when you're with policymakers, because they are expensive to the patient, right? That is a lot of out-of-pocket cost. Even the 25% can be a lot. But compared to the cost of treatment for other diseases, they're not expensive. I mean, look at how many thousands of dollars every month certain medications are, or, you know, prosthetics or other things that, I mean, I'm not all of these things are necessary for patients, right? But when you compare the cost of compression garments to the cost of other treatments, especially for other treatments for chronic diseases, compression garments are not expensive. So it's important to not refer to them as expensive. It paints the wrong picture. I think it can scare the policymaker more when they're already concerned about cost, right? If you use the word expensive.
That's an excellent tip right there, and perhaps comparing to other more common medical devices, because in Canada, most compression is, again, covered under medical devices. In comparison, it's probably one of the least expensive then.
Yes.
Good point. Very good point. So now that Treatment Act has passed, explain some of the barriers you encountered along the way and how you overcame them.
Well, as I've mentioned, in the process of passing the bill, cost was the biggest barrier. In the beginning, it was lack of awareness. So I would say, we would have probably gotten more traction more quickly had we gone into offices to speak about a disease that they'd heard of before, right? So really those first couple years was just helping them to understand what lymphedema is. And so that was the first battle. But thankfully, when people don't recognize the word, but everybody can relate to it being a cancer survivorship issue. If they haven't personally experienced cancer, generally someone in their family has, or someone close to them. So when you put it into the context of that all cancer survivors are at increased risk for a lifetime, you can kind of, quickly connect with them in a way that makes it personal to them, even though they've never heard the word lymphedema. But after we got over that hurdle, definitely cost was the number one obstacle. So as I've already said, any talking point that can help to counter that, I think the most powerful one is, look, you're spending this money already and more on infections, hospitalizations, and other complications that you could be preventing with this less costly care that would also greatly improve the patient's quality of life. And those are things that are quantifiable. But then there's the other things that it's very difficult to put a dollar on. Lost productivity at work, lost ability to care for your family. There's other things it's hard to put a monetary value on as well, but are worth mentioning. And one of the most important things that our group did was invest in a cost savings analysis. So we hired a healthcare analytics firm, which is a very expensive thing to do, but we got to the point where that was like such the sticking point that we needed to get past, that yes, we could go in there and say everything that I've been saying. We could print out, things like from the New England Journal of Medicine, very prestigious, publication saying, here's the incidence of hospitalization when lymphedema is untreated. But they really needed to put it in real life dollars to understand how much it was costing them and how much it could be saving them. And even had we had the capability of doing the math ourselves, it wouldn't have had the same weight as coming from a professional healthcare analytics firm that does this and is well respected. And so if it's something that you might be able to do in the future, I do highly recommend it. And I don't think you need a separate one for each province. Everyone should be pooling their resources to get one report together that then can be used nationwide. So that was really our biggest sticking point. I feel very blessed that this isn't a partisan issue. I mean, things are even more partisan in our country now, but they even were at the time that we were working on this. And so that I think that was kind of a silver lining to lymphedema not being part of the public awareness, is nobody had a preconceived position staked out on one side or the other. So it was a wonderfully nonpartisan issue. So yes, we still did have a harder time with some offices than others. The offices that were very hardline, no new spending, those were harder to convince that the savings was worth the expense. But I think the fact that it was not already known was maybe in the long run a blessing.
So you're on the home stretch because, well, people think you're on the home stretch because the Treatment Act has been passed, but there's still a lot of challenges, right, that exist. And what is your group now spending or focusing the time on? Implementation or acceptance of this act?
All of it, really. So the Medicare coverage is very good, thanks to the rules, but it's not perfect. It could be better. So there's ongoing work there to make sure that the Medicare coverage is as good as it possibly can be. And then in our country, there's the original Medicare, which is a government-run program. But now you have the option to basically allocate your Medicare over to a private insurance company. Those are called Medicare Advantage plans. And so those Medicare Advantage plans run by private insurance companies are supposed to follow the same rules, but we're finding that's not always happening. So a lot of our work in the last couple of years is getting those Medicare Advantage plans to comply with the new law. And then, of course, it branches out from there to all the other types of insurance plans, which are not required to follow the rules and the new coverage under the Lymphedema Treatment Act, but we hope that they will. So those that haven't voluntarily already come on board, it's working with those individual insurance companies to say, hey, look at this new Medicare coverage, and using many of the same talking points that we did to pass the bill. Look, it's going to save you money in the long run to provide this coverage, to try and bring them up to the same standard of care. So there's really a lot of work to be done. And that's just still on the policy improvement side. And then there's the patient and provider education side, making sure that everyone is aware. There's a lot of new documentation requirements. When these were just items that patients went and purchased themselves, they didn't even have to formally be diagnosed with lymphedema. They didn't need a prescription for the items, and they didn't need clinical notes. And now all of those things are required to get their insurance to cover them, whether it's Medicare or another plan. So this is no different than anything, any service or device that might be covered by your insurance. You always need the diagnosis, right? The prescription and the clinical notes to back it up. But patients and providers are not used to providing those things for compression supplies because they weren't covered in the past. So there's been a big learning curve involved. And so that's a big part of what LEAP, the new organization, is focused on.
Yeah, the insurance is certainly an opportunity where some provinces have attempted or are thinking of attempting to contact. Again, there's so many different insurance companies and there's so many different plans within their policies, many of them group plans and company plans. So depending on whether you're working for American Express or whether you're working for Price Waterhouse, the same insurance company could have totally different plans for their different demographics. So that's even more complicated, I would think, than addressing the provincial coverage. But it's also an area that needs to be. So there are many opportunities for advocacy. We're running a bit out of time. I think we've done it a bit earlier, but if we could put on the screen again some of the wonderful resources that your two organizations has. And excuse me, those. Certainly, some of them might be a little less relevant to Canadians on our call, but I also want to let our audience know that the resources of the Canadian Lymphedema Framework are available for patient education, and a lot of that material can be found on the website, within the Pathways magazine, You can find the reimbursement charts, etc., and that could be something that could be very valuable in your conversations with policymakers. If there's one important piece of advice you want our listeners interested in advocacy to take away from the discussion, what would it be?
Really just that you need to approach this, that it's a marathon, not a sprint. Big change takes a lot of work and takes a lot of time. And so to make sure that you keep your eye on the big picture to avoid burnout and frustration. Yeah, I think that's the most important thing. And I think that really might ultimately have been the key to why we succeeded. I mean, it took nearly 13 years. There was a lot of people who didn't think it was ever going to happen. Even people working on it with me who thought, well, we're fighting the good fight. We're doing the right thing, but I don't know it's ever going to happen, you know? So just not giving up until you get there. And I just sent a link in the private chat that might be worth sharing, or we can share it with viewers after the fact. I wanted to mention that on our lymphedemaadvocacygroup.org website, we still have a page that is archived from the time that we were working on the bill. And that page has links to all of the different materials that we had created for congressional offices. So if you go under that, the LTA tab, then one of the options there on the menu will be congressional materials. And we've left that as kind of a historical snapshot in time, precisely so that other groups working on similar issues can see the types of materials and resources that we put together to help convince lawmakers and eventually get this done. So some of the things I talked about, like the cost savings analysis, that is there, and other materials as well.
Great. I also want to remind listeners that some of you may be supporting a provincial association. Some of you are not and on your own and interested in advocacy. There are infrastructures out there already. These organizations, these associations really need your help. And so, a concerted effort within a particular province that's already set up, has already made contacts. Some of them have good relationships already with their provincial policy makers. Call them up and ask how you can help. A single voice never is as powerful as, a group of dedicated people that have the resources and have access to some of the materials, etc. So I encourage you to call and join. We monitored some of the questions that came in ahead of time. Most of them were some top tips for advocating, which Heather's very well done already. I do want to remind people that any of the medical questions related to lymphedema itself and treatment options are not being addressed today. I'm not a medical professional, neither is Heather, and the topic of today was advocacy. But however, we will, as a follow-up to this call, link some of your questions that were submitted to articles where this topic has already been covered in Pathways. And you might have some of your questions answered that way. We encourage you to ask your lymphedema therapist, who is an expert on some of the questions. And there are some great questions that I will endeavor to include in an Ask the Expert section of a Pathways magazine in the future, where we can actually ask medical experts, which, as I said, we are definitely not. So we try to keep these to an hour. I'm going to say thank you to Heather for so much of your time, not just today, but in preparing for this event. The little tech visit we had yesterday, just make sure that everything was up and running, and thanks to Bonnie and Grace. And I wish you and your family and your advocacy efforts all the best. Bonnie, over to you.
Thank you.
Thank you so much. This has been wonderful. And to everyone who's joining us online today, thank you for joining us for this edition of Pathways Live. We're so glad you could be part of today's discussion, and we hope that you found it meaningful and insightful. Once again, I just want to thank Anna and Heather for this wonderful discussion. And I would just also like to take a quick moment to surprise her and introduce you to, hello, Grace. Grace, our marketing and communications manager, who works really hard behind the scenes to make this series possible and keep things running smoothly for us. Thank you all. I would also like to just take another moment to thank our sponsors once again, to thank Bauerfeind and Juzo, and also Essity, Medi, Waries, Sigveris, Lymphology Skincare, and L&R for their generous support. We're so excited for our Pathways Live series, and we're already busy planning our next episode to take place later this spring. Stay tuned for updates and announcements in your inbox very soon. Our spring issue of Pathways is available digitally now, and our print subscribers will receive their copies later this month. The CLF is very pleased to share the spring issue with the entire global lymphedema community with our compliments each year as part of our celebration of World Lymphedema Day. So if you registered, you can find that on our website, canadalymph.ca. If you registered in advance to be with us today, watch your inbox for a follow-up email with some links for further info. And finally, we'd love to stay connected. So if you have any questions, feedback, or ideas for future sessions, please don't hesitate to reach out and get in touch. Thank you once again for spending your time with us today. We wish you all a wonderful World Lymphedema Day, and we look forward to seeing you again soon. Take care, everyone. That's it for today.